My name is Shasta Jackson. I'm a licensed clinical social worker and I hold a doctorate in behavioral health. I am the manager of outpatient specialty for behavioral health services at Valleywise Health.
Hi, my name is Dr. Eris Mosley. I am the medical director of the First Episode Center in Avondale.
My name is Carl Mitchell, and I'm an emergency medicine physician. I specialize in emergency ultrasound, and I basically teach residents how to be doctors.
Hi, I'm Charmaine Jackson, CRL at CHC Pediatric Clinic. Been with Valleywise for a little over 11 years.
Hi, my name is Deanna Green. I'm a supervisor for discharge planning here with the Inpatient Care Management Department at Valleywise Health Medical Center.
I was born and raised in Plaquemine, Louisiana.
I am born and raised in Phoenix, Arizona.
I grew up in Buffalo, New York. I was born and raised there.
I am originally from England, London, England, right north of London in the UK, and I lived there till I was about 10.
I was born in Louisiana and went to Hot Springs, Arkansas around 7 years old. And I grew up there until I left to go to college.
I'm not quite sure how it is I actually decided to become a physician. I have always wanted to be a physician ever since I was a little girl. The concentration or focus of what I wanted to do in medicine changed over the years, but my path led me to psychiatry, and it has been the best decision.
The reason why I made the change from being a paralegal to working in behavioral health was because I was working with the population of homeless individuals in the city of Detroit, and I recognized that so many of them needed additional support that was related to their mental health needs.
I actually thought that I was going to be a pre-med student when I got to college, started that pathway and found that it wasn't really where my calling was. Moved into social work and then found that that was really where I wanted to be in terms of learning how to work with people and not necessarily just treating one particular piece of them. I find that in social work, you're treating a lot more facets of each individual person.
When I was 12, working as a volunteer, I was in postpartum and labor and delivery, and watching nurses, watching the team, how everything functioned, how it worked, just fascinated me. And from that moment, I decided I wanted to be a nurse.
When I was 15 years old, I joined the Church of Jesus Christ of Latter-day Saints. The family that fellowshipped me, the father was an ear, nose, and throat doctor. I would see how he interacted with other people at church, and I noticed how he interacted with his family, and that was just an exciting thing. I thought to myself, I wanted a house like he has. I wanted a family like this. Instead of wishing for it, I decided I was going to make it happen. So I decided to go to medical school.
For me, when I think of Black History Month, it's more of a time of reflection and reverence for those who have come before me in all walks of life.
I think about being a first generation college graduate. I think about those who may have had to struggle to even participate in things like education.
One of the things I enjoy doing is reading about people who have invented things that I didn't know existed. Black people who have invented things that I didn't know contributed to our society.
With Black History Month, we get to celebrate all of our accomplishments within, historically, the Black community.
To me, when I think about Black history, I think about role models that we don't know about, that we need to discover, and the importance of being a role model so that we can create the future, and so we can represent the history for our future generation.
I will say, speaking specifically for Valleywise, I believe that we are on a continuing positive trajectory in terms of getting different faces in medicine. It doesn't matter what the title is. Is it a physician? Is it a nurse? Is it a tech? Whatever the position is, I think that we are getting better at that, again, because it is so important for our patients to see themselves in those who are taking care of them.
I'm honored that Valleywise has been persistent in ensuring that they always talk about honoring Black History Month, and they choose our leaders to make sure that we are represented clearly and consistently throughout the agency. And it's really awesome to be able to see that Valleywise is definitely trying to focus on diversity and inclusion with all races.
Diversity and inclusion is something that I think has always been a piece of what Valleywise does. You know, having worked here for almost a decade, I've seen a lot of changes, and I've seen kind of an increase in diversity in staff. I think we've always had an extremely diverse patient population, but I've noticed more of an effort to recognize and understand and make space for different cultures.
So I found over the years that as much as I think that I'm just a regular guy, it's really important for patients to see a Black doctor. It's also important for the Hispanic community to see somebody who speaks Spanish fluently. And so I kind of have a dual role.
As an African American female, of course, I experience a lot of people who are of my culture who would not usually even seek behavioral health services. And so it's easier sometimes for me to connect with that family to understand a little bit more about their religion, about the culture, about the language, about the expectations even of how parents feel about their children. Because I am from the African American community, it matters for me to be able to connect with those who may need me in order to get to the services that they need to receive in order to be well and to do well.
Speaking for my members and patients, and even myself as a patient, there is a comforting effect and almost a relaxation that happens when you walk into a room and you see someone who looks similar to you or whom is simply a person of color. There's an ease and an idea of that there may be a better understanding of what your experience is in the arena of medicine as a patient.
Part of working at Valleywise that really keeps me working here is that I really enjoy an opportunity to be that representation. So if I walk into a patient room, sometimes I notice a little bit of a sigh of relief if someone who looks like me sees me and it's like, okay, she looks like me, she might understand me a little bit better, she might listen more than someone else does. So I think it's really important to be able to be that recognition and that mirror for our patients.
When families can recognize themselves in the person that's taking care of them, there is that level of calmness and understanding and acceptance. And I think Valleywise does a great job of making sure that we are all equally represented. Whether it's race, whether it's religion, multiple cultures you're going to see here on campus.